Thank you for joining us. The Lieutenant Governor was actually evacuated earlier today from the state capitol. So he'll be joining us by phone for the first few minutes and then by video. And then we are also thrilled today to be joined by Dr. Angela Dunn, who is the state epidemiologist. And so Dr. Dunn, thank you very much for joining us on the call today. I'm Cameron Dale, the director of the league, and Brandy Grace is the co-host. Brandy, you can see on the screen, the director of the CEO of the Association of Counties. Brandy, if it's okay with you, how about we get started with Dr. Dunn, and then when the Lieutenant Governor arrives, then we can bring him in accordingly.
I totally agree. Dr. Dunn, we appreciate you being with us today. This shakes things up a little bit. We're excited to have you with us.
Yeah, happy to be here. Thanks so much.
Perfect. Well, Dr. Dunn, thank you for all of the work that you've done both behind the scenes and in front of the cameras over the last few weeks. I acknowledge that 2 months ago, I didn't realize that the state of Utah had an epidemiologist. I'm still not sure I can spell that word, yet I feel like you're a part of my daily life now. So thank you for
better
all
or
of your
worse,
work.
Right?
Exactly. So let's give you a few minutes to give us your perspective of where we are, where we've been, and where you think we're going.
Sure. So, in Utah, we have definitely flattened the curve over the past 10 days. That means that we've just seen a plateau in our growth rate. And that's an excellent sign. And that coincides, of course, with going to orange, which I know is a topic for today as well. But a lot of that is because we've had the ability to test everybody who needs a test and also do contact tracing. So identify how someone got infected and anybody who came into close contact with them and give them isolation and quarantine guidance so that they prevent spread. So these are all good signs for Utah. We are looking for that downward trend of cases and hoping that it'll come soon. And that will give us a lot more confidence to, reopen even more parts of our economy and society moving forward. But our hospitalization rate is still very low. We're at about 9% hospitalization rate. National estimates are at about 20%. In terms of positive rates, so if everybody gets tested, how many people are positive? We're at 4%. Nationally, that's 18%. So we are definitely on the right track here in Utah and are hoping to continue that.
Terrific. Thank you, Doctor. Last week was a big week. In fact, we're now in that orange state. You just gave some of the positive news. So with our format is we accept questions from city and county leaders from around the state through the day before, and then we share those questions with the Lieutenant Governor and his team. And so one of the big questions that we've received has just been what the conditions are for consideration as we move into the orange phase and potentially into the yellow phase. So what can you tell us about the different factors that you're looking at from a public health perspective as we are now fully into the orange phase?
Sure. So absolutely. One of our primary goals is to maintain healthcare capacity. So to not overwhelm our healthcare system so that no matter who needs healthcare for COVID-related reasons or not, they're able to get it. So we look at hospitalization rates and ICU beds and make sure that they're below a certain threshold. And that's set by our Utah Hospital Association and our healthcare work group. The other thing we look at is, of course, our growth rate in cases. And so I kind of mentioned that we were plateauing before. So we look at a consistent plateau followed by a decline in cases in terms of growth rates. And there's a number of ways to look at that, but that's essentially what we're doing is making sure that we're now plateauing and hopefully going to start seeing a drop in our cases from day to day. And that will give us oh, thank you. I was like, what's happening on my end? So that'll give us a lot of confidence that, opening up society didn't result in a surge of cases and that we can even do more to open it up. But at that same time, we have metrics that will trigger us to go back to more restricted measures, right? So if we start seeing a surge in hospitalized cases, if we start seeing a trend in a spike upwards, that might be indications that we need to put those social distancing restrictions back in place.
Andy, your question for Dr. Dunn.
Yes. Thank you. Dr. Dunn, some of our cities and counties have reported difficulty in obtaining the data relative to transmission rates in their communities. Can you tell us how they can obtain that data or point us in the right direction of where they might be able to find that data relative to their own community?
Sure. So they definitely, the first step is working with their local health jurisdiction. In terms of specific transmission rates on small areas, it's really hard to calculate because it requires a lot of data going in. And so the important thing about giving confident numbers is having a lot of data. So we're able to do that statewide. We definitely have jurisdiction and county level data, and that's supplied through the local health departments. So that's where they would go to get that specific data and make that request.
We have seen some complications though with, at least on the city level, trying to get that specific information from local health departments. So do you have any recommendations for how those cities can, or like what they should be asking for from the local health departments?
Yeah, so we break our data down. So we supply the data to the local health departments by their jurisdiction, by their county, and then by something called small areas. In public health, we break down all of Utah into 99 small areas, and those are essentially neighborhoods. So they're community defined geographic areas, and that's the level that you want to do an intervention out. So everybody that lives in that small area is united by culture, by other kind of defining characteristics, and they see themselves as a community. And so you can get that data by local health jurisdiction or by small area. You know, in some jurisdictions have the capacity to do zip code level data as well. So that's out there at our local health department level. So definitely ask them for that.
Is there a reason that they may be hesitant to share that information, as we have local county officials and city officials looking at decisions that need to be made for their communities? Is there a reason that the health department may be a little bit apprehensive to share that? I mean, obviously,
yeah,
and HIPAA concerns and those kinds of issues, but that information is very important for those local elected officials to make decisions.
You know, I think a key piece is combining that health expertise with the policymakers, because some of this data is very dirty, so it's going to take some interpretation to be able to make the right conclusion out of the data you're seeing. So, you know, some health officials might be wary of just handing over kind of an Excel spreadsheet. So it's probably better in a conversation setting where, you know, the elected officials can ask questions and the health officials can help interpret that data and then maybe analyze it differently to answer your specific questions. Another scenario is certainly privacy, especially when you get into the rural communities with really small numbers. We in public health have a duty to protect the privacy of everybody whose data we have. So when we get really small numbers, we just can't release them. And so that might be part of the reason as well. But in general, kind of trends and those types of conversations can happen. And it's probably better starting with a conversation and then going from there.
So let me give you a real life example of what one community is facing. In this particular community, they've been requesting that specific data from the health department. They've not been able to receive it. Now that community is trying to figure out how to implement the orange and then potentially the yellow around outdoor sports and other parks and recreation programming that the city provides. And so they're concerned about providing that programming without having a better understanding of the data. And what they see in the news is they'll see the death counts. And in this particular community, they've actually seen a handful of deaths in their city. And so that's in part what's leading to their anxiety. In another community, they were told that once it got to a certain threshold, such as 20 infections in the community, that then the county health department would share that information, and that's not happening. So that's why we're looking for guidance from a UAC and league perspective of like, how do we get this information so that the policymakers who are trying to implement orange and will have to implement yellow have as much information as possible.
Yeah, I get that. And when you said 20, that's generally our threshold for not releasing data. So they're probably doing that to protect the privacy of individuals. You know, we have weekly meetings with all the local health officers about policy, and I just wrote it down to note. And Cameron or Brandy, can one of you be the point of contact? I'll bring this up, and maybe it's just a conversation between you guys and them to talk about those barriers and figure out how to work out that data exchange. We at the state, I mean, all of our local health jurisdictions are autonomous. And so it's their data, so we wouldn't be able to provide that from the state level without their authority either. But I'll bring that up on our policy call and then connect with you guys if that's all right.
That would be great. Thank you. Dr. Dunn, can you speak to what you know about outdoor temperatures, and do we know how that affects the spread of COVID-19?
Yeah, so we don't yet, but all of those kind of assumptions are based on what we know about other respiratory viruses. So the flu and other coronaviruses. I mean, coronaviruses cause the common cold, and all of them dissipate in the warmer weathers. It gets better in the warmer weather. We don't see as much spread. And a lot of that has to do with the lack of humidity in the air, or the increased humidity in the air. So the more humid the place, the hotter the place, the respiratory viruses don't seem to thrive as much. But in the drier cold, they seem to thrive more. You know, time will tell what happens with COVID. I mean, that's the problem with this whole pandemic, is that it's a novel virus and we can't really predict what's going to happen, but we're certainly hopeful.
There is a process for cities and counties and communities that have identified hotspots to access what the governor refers to as a strike team around testing and tracing. Can you just talk through how a community that may have a hotspot develop, how they would partner with the state to tackle that hotspot?
Yeah, I'll let Dr. Dunn do that.
Sure. So this is kind of bread and butter public health. Whenever we identify a cluster of cases by geography or time, we definitely pounce on that. And with a pandemic, it's even more important. So a great example is what we've done with Utah County. They saw their cases rising, and they were rising in a couple of specific neighborhoods that had specific issues related to the rise in cases. So our mobile testing team through the Utah Public Health Laboratory went down there and did very targeted testing. We worked with Intermountain to do targeted mobile testing as well. And our investigators are partnering with the local health department there to ensure that they have all the case investigation and contact tracing resources that they need. What was identified in this specific case was the need to have more Spanish-speaking contact tracers and case investigators. And so we were able to work with them and supply those specific needs to address the issues. And this specific town tended to be a worksite issue. And so being able to identify the source and work with policymakers around kind of better ways to prevent spread moving forward was a key win for this. And Utah County has since seen a leveling off of those hotspots. So it is encouraging, but that's just an example of what we would do for any hotspot in Utah.
Is there any potential timing or projections or anything that would indicate maybe when the statewide would move from orange to yellow?
I don't want to step on Lieutenant Governor's toes, so let me know. Would you like me to start that off?
No, look, so the best part of this whole call is that Angela is here. She's a rock star. Let's get all the answers we can from her. You've heard from me every week now for 5 weeks. Go ahead, Dr. Dunn.
Sure. So we actually have had meetings today, and we'll finish up tomorrow about finalizing those metrics that'll move us specifically from orange to yellow. What's great about this process is that we've got a team of really smart people from a lot of sectors that are coming together to evaluate our data constantly. And so we're being flexible. So the data coming in is providing better information about what metrics we're going to see. So specifically, we're looking at, again, making sure that we maintain a surge capacity in our hospital beds. So we're looking at only filling 60% of our hospital beds just in case we see a surge. We're looking at seeing that transmission rate be around 1, or you know, what that would look like in practice is seeing a plateau and a decline of cases. And we're also wanting to maintain our testing capacity, because we don't trust, you know, if we stop seeing cases, if it's because we stopped testing, right? So we want to stop seeing cases, but still have really high rates of testing. So those are things that are going to move us to yellow if we're able to kind of keep the same trajectory over the next several weeks.
The only thing I would add there is that, you know, when the governor released that, and as we've talked with local health departments, and I know we've talked about it on this call, is that we'll be looking at the whole state. There are opportunities to move sections of the state the data supports that. We've already had a request for Washington County and that area. That will be reviewed by the the experts and the governor in having those conversations. And so we really want the incredible thing about what Dr. Dunn and the team at Department of Health and everyone else has worked through on this testing and tracing capacity now is our ability to really look at different areas, look at these hot spots differently, and just as we're looking at hot spots, also looking at cold spots differently, and being able to make better decisions. Now, there is a lag, and we talked about that in the very beginning. There's a lag between the time that spread happens and the disease can manifest itself. And so sometimes you don't know for a week or two what's actually happening. We're kind of looking back and trying to see where we were and what happened that may have caused these things. And so we're going to want to be careful, but also we want to make sure that we're doing everything we can to get every part of Utah back to business in every way possible. So those are the conversations we're having with Dr. Dunn and all of those teammates that she mentioned.
Lieutenant Governor, as a follow-up to that, last week, the League and UAC did several town halls where we talked through the process of the state moving from red to orange, and then the process for local variability, whether that was orange going back to red because of a potential hotspot, or orange going down to yellow. We also talked about the Utah Leads Together 2.0 plan and the appendix number 4, which had the most updated version of the phased guidelines. Can you give us some indication about what the next steps are with Utah Leads Together 2.0, potentially the Utah Leads Together 3.0 that could be coming later this month, and just also walk through that process if you are a local government that feels like the data should push you to red or to yellow, and how to make that request formally through the state.
Yeah, thanks, Cam. So version 3.0 is already well underway. We've got lots of incredible people that are working on that and taking feedback, from what we've learned from 2.0 and this transition from red to orange. There's a lot of work being done right now on churches and faith communities, a lot of other areas that are being worked through. And so we anticipate that within the next week and a half, that maybe 2 weeks, that next version will be ready. As far as that process goes, just a reminder too, we want to work very closely with the local departments of health. As Dr. Dunn said, they are critical pieces of our response here in the state of Utah. They are independent. And so as those communications between the local health department happen, then they will take those recommendations to the state health department, to Dr. Dunn and her team, and General Burton, and they will have those conversations and then bring it to the governor, who's working in conjunction with the legislative commission that was stood up. So all of those pieces are working together, but it's important that we follow that, again, kind of laid out in statute. That's the direction that we're going, and that will help us make better decisions, again, with local input, but also with some state supervision to make sure that we're all on the same page.
My follow-up question to you, Dr. Dunn, is if there was anything you wanted to add to what the Lieutenant Governor explained there about the process in orange to yellow.
Yeah, no, that's exactly the way I understand it as well. I just encourage everybody to get to know their local health officer so that those decisions can be made together and hopefully be seamless. I mean, it's a confusing time for everybody because we've never made policy to go from red to orange to yellow, and we've certainly never implemented it. So patience and flexibility are going to be key throughout this entire process.
One thing for both of you to know is that in the town halls we were doing last week, and we solicited a lot of feedback from our members about how to implement orange, and then looking ahead to what a yellow world will look like. And we've been taking that feedback and we're sharing it with the state through the local health departments. So we've shared it with Jill Parker, who is our counterpart at the Association of Local Health Districts. And we'll also be sharing that with Kristen Cox and Adelie Gochner and her team, so they can be incorporated into those yellow guidelines for 3.0 as well as into future events. So for example, we've been looking at live events. How do you have 4th of July festivities in light of orange or potentially yellow? How do you have other big live events? What about summer swimming pools? There's some guidance in orange around swimming pools, but it's not really thinking about the water park and the water feature and the staple of summer activities. So we've been working through all of those, and we've submitted a lot of that feedback, and we'll hopefully see that implemented into 3.0. Brandy, your question.
Thank you. I'd like to ask about outreach to high-risk populations. And Dr. Dunn, you mentioned, for example, needing Spanish-speaking outreach to take place. In the governor's press conference a couple of weeks ago, he talked about the importance of that and identifying those different populations and how we may improve communication and outreach to them. I serve on the Public Health and Economic Commission, and we've had those conversations. I've suggested making sure to coordinate with the AOGs and other entities that provide aging services. Can you tell us what's being done from the state level to coordinate that effort, and specifically what we may do to help with that effort?
Yeah, so this has been a key priority for us from the beginning. We have a vulnerable populations group that at the beginning of this reached out to all of the different community organizations that served our vulnerable populations. And that's defined so broadly, right? Vulnerable to getting disease, vulnerable to getting severe disease, vulnerable to the economic impacts of being isolated or quarantined. And so we got an assessment of all of their needs. At that time, most people needed testing and PPE, right? And now we're talking more about those wraparound services. So if people need to stay home from work for whatever reason, how do we ensure that they have the ability to do that through, financial services, social services, those types of things? Because we have found, and this is known, but pandemics, being socially distanced, enforcing isolation and quarantine, that is all fine until you're somebody who has to go to work, regardless of your illness, just to put food on the table. And so that's what we're really focusing on, the Department of Health. And I know there's also a task force out of GOMB, and they're working on kind of the aging population and making sure that those needs are met. And again, it's not just it's from identifying disease and providing services that are health related, but also those wraparound services to ensure that, their mental health needs are met and their social wellness is met as well.
Lieutenant Governor, anything to add to that?
Just to say that we're really grateful for these teams that are focused on this. I had a meeting with Chris Cox earlier today where that was brought up, and we one of the important things as we talked about reopening the economy, it was how do we protect those that are most vulnerable as we do this? Because the more interaction that we have and the more we move around, the more likely it is that the disease will spread to those who are least able to handle it. And so we really care deeply about our underserved communities and about those high risk communities. And we're excited with the things that Dr. Dunn mentioned and what we're going to be able to do to help them out.
By extension, what can you tell us about what you're seeing on the ground with people wearing masks and taking the recommendation around masks seriously? And is there additional messaging that you would like to see from local government leaders about the importance of wearing masks and following the other recommendations during the orange phase?
Yeah, so I actually get asked this question a lot, and I literally never leave my house or my office, so I have no idea what's going on in the real world. But I have heard that it's hit or miss, and that's what to expect, right? Some communities are wearing masks in all the right times and places, and some aren't. So, I think from a local government perspective, it's really important to get that messaging out that when social distancing is impossible, wearing a face covering is essential to preventing any inadvertent spread to anybody. But, if you're on a hike by yourself or socially distanced from people outside of your household, you don't need to be wearing a mask. So it's not something that, no matter what, we have to have masks on or face coverings on. But in the appropriate times, it is really essential.
We live in a crazy time. As Dr. Dunn mentioned, this whole going from red to orange, that this is something we've never done before. We didn't know there was red or orange or yellow. This was not a thing until a month ago. And the same thing with masks. When I say we live in a crazy time, it's not just this pandemic, but it's the way we politicize everything. And I hate that piece so much. This idea, I don't know where masks became such a polarizing thing, and I wish they weren't. And I think, part of it has to do with our messaging, and the message is this: like, this is a substitute for everyone staying at home, and it's a really great substitute, for those that, again, if you're seriously ill or in one of those high risk categories, you should still stay home as much as possible. But this is a great way out of this. And the easiest way to get to yellow is to go into orange and not have significant spikes in cases. And if wearing masks can help us do that, why wouldn't we do that? And so what I would say is, I think there's definitely kind of a social stigma around it, because look, I hate it. It's a pain. I really, really don't like it. I wear masks on the farm often because I have severe allergies, so I don't like it then. I don't like it now, but knowing that I'm keeping people safer, especially as we know there's much more asymptomatic spread of this disease than we originally thought. And so, keep putting a mask on. If you have it and may not know it, it prevents you from spreading the disease. And if we're all doing that, then the disease gets captured. It's almost like we're all at home, but we're doing it, at Walmart together, or wherever it is that we have to be. And so we're really trying to help. I hope you all heard the announcement. And I think we mentioned this last week, that the state of Utah, manufacturers in Utah are producing 2 million masks. And you can order those at coronavirus.utah.gov/mask. And we have had, I believe, over 700,000 masks ordered. We're producing, as I mentioned, 2 million. So that's good news. And it's, again, it's not something we're going to do forever. As soon as we've gotten to a place where we have treatments for this disease, then we won't have to do it anymore. But for right now, why not? Let's do this.
Can we expand a little bit on PPE and talk about what is the state doing to coordinate the supply chain of PPE, not only for residents, but also for businesses and for local governments?
Yeah, Dr. Dunn, anything?
Okay, I was going to say, I only know very minimal of that. I know that it's being done, and that's all. So I don't know, Lieutenant Governor, if you have more details.
Yeah, no, thank you. And we'll try to, I'd like to get Jess Anderson on with this group to talk more about that as his team is overseeing that. I know that they're working closely with our local health departments, but they're also working to take some of the supplies that we've gotten and put together packs of PPE for businesses and others that need it. And so that's a project that they've been working on very closely. I understand there were a couple hiccups yesterday and today as they've been working through that. I haven't heard the latest, but there is, what I would say, stay tuned. There is more information coming on that, and we really do want to be helpful to those businesses and locations that need help finding PPE.
I would add that both UAC and the League are participating with Teresa Foxley's Critical Infrastructure Group that's been looking at the PPE supply chain and been in discussions with the Utah Manufacturers Association around the supply chain. And we've heard from members from Green River to Cache County and everybody in between who are checking their supply chains and ensuring that they have sufficient PPE in order to open under orange and eventually under yellow. To that end, Lieutenant Governor, when you and Justin and Chief of Staff Justin Harding joined us last week, you gave us a sneak peek of the governor's order that went into effect this past Friday. That goes for a couple of weeks. What's the timing for reevaluating the next steps of the order? I recognize you are looking at data on a minute by minute, hour by hour basis, but like working backward from when that order expires, when should we anticipate that decision-making process to occur about what happens after the order?
Yeah, so Ken, that will start in earnest next week. And leading up to that, the governor, again, in consultation with our health department and others, will be looking at that, looking at any recommendations that may come from the health and economy commission, or what I forget what we call that, Brandy, and then making a decision on where that goes. But again, I think there's definitely some discussion about, are there places of the state that could move to yellow? Are we there? We want to have enough time to see what happens in the orange phase, which we just started a couple days ago. So he'll be looking very closely at that. But yeah, we'll give you a heads up as that decision-making process continues.
That will be a big deal for live events. That'll be a big deal for social gatherings. That'll be a big deal for public meetings, because the change from red to orange really put a marker down that the trend is positive, but where the difference starts to occur is when you go from orange to yellow. So we have an internal team that's working on live events. We get questions all the time about the 4th of July and those other events. We've been getting questions with more and more regularity the last few days around open and public meetings during that yellow phase. So the message for the audience is stay tuned. Next few days will be important.
And Cam, the one thing I would add, some of you may have seen last week that the Days of 47 decided to cancel their events, and that was, I just want to share this, that was not a decision that was made by us, or really, I mean, there was definitely consultation, but no recommendation came from any of us on that. That was really a decision that was made just by the governing board and the Church of Jesus Christ of Latter-day Saints, who was involved in that. That was a kind of a preemptive decision that they made ahead of time.
Can we pivot and let's talk a little bit about economic recovery? I know it's on everyone's mind that CARES Act funding has been distributed, and there's a lot of talk about what's happening with that. There's also been some recent Treasury guidelines that indicate some funding can be used for economic revitalization efforts. Lieutenant Governor, can you talk to us about anything that the state is doing, or avenues that local governments can participate in determining best use of those funds and how we can coordinate that effort?
Yeah, so we don't have any formal recommendations yet. We finally got the guidance that we've been waiting for and told we were getting every week, and now we've asked GOMB to sit down with the legislative leadership and start working through what that process could look like and where it goes. I'm really pushing for local flexibility. We've argued for that at the state level, and it's something that I believe in that we should have at the local level as well. And so that's been my recommendation to those teams as they start putting that in, or putting that together. We do know, again, that there's a chunk of that that's going to be used directly for our response to the disease, but there's definitely going to be money left over to help with economic recovery. And so we're not all the same. And what works, for Kane County and Garfield County is going to be very different than what works for Utah County and Cache County and Davis County. So we want to make sure, again, when I say we, it's the governor and I that are really pushing to allow for local flexibility and make sure we get as much as possible. Which also leads to right now the question about what happens in the next round. I know we've had some initial conversations about what that might look like with the vice president and the president, with our local delegation as well, our congressional delegation, and making sure that whatever that looks like, again, that the same thing applies, that we do get money to help local governments that have been impacted, and that they're able to use that for the recovery process for lost revenue. And the governor has said he supports that if they're going to do it, that he supports being able to use that for lost revenues to backfill some of that as a result of what's happened with this virus. And so I do think it's important that we work together to have a unified message wherever we can. And we're certainly anxious and willing, and I know you both have been in on those discussions. And I think if we can join local government with state government together with our congressional delegation, that makes for a much stronger advocacy position for all of us.
Amen and amen, Lieutenant Governor. You mentioned both the CARES Act and the potential fourth stimulus. And just as an update for you and those on the call, the League and UAC have been working over the last couple of days discussing potential distribution formulas for the local component of the CARES Act and the local component that the state received and will be sharing with local governments. Then you have the CARES Act dollars that the state received for state purposes that you'll be using for economic recovery. And then late last night, about 9:30 last night, our time, 11:30 DC time, new FAQs came out from the Treasury Department that we'll be sending out to the membership today about how they can use those CARES dollars. We also had a town hall yesterday with Senator Romney, who expressed his support for additional dollars for state and local governments and had that same plea to our members to work together with the state and have a unified voice coming from the state of Utah. So it's great to hear that we are all singing from the same sheet of music. Recognizing that we are about out of time, Dr. Dunn and Lieutenant Governor, any final thoughts and any final words from the two of you for the mayor's council members, commissioners, and city staffers on the call?
Go ahead, Dr. Dunn.
So I can start. So I just want to, obviously, thank you guys. You guys are on the front line dealing with both the economic and health crisis that befalls us. So I really appreciate your support. And I'll follow up on the things we talked about regarding data and try to see if we can come to some sort of conclusion that'll help both you and health. And just really appreciate you being open and honest and flexible as we move through this. So thanks so much for the opportunity to be here.
Thank you.
Yeah, and I want to thank Dr. Dunn for coming on today and helping me out, and again, most importantly, just kind of underscoring what she said about our ability to work together and everybody's patience and collaboration. Again, there's no there's no roadmap or rule book or instruction manual for how to get through the worst health and economic crisis of the last 100 years. And so we're writing those instruction manuals and those roadmaps as we go, and we're making our own future. And we're doing it in a way that is making a lot of other states really jealous. And look, this is incredibly hard. It's crushingly hard, and the numbers are staggeringly difficult. And yet, at the same time, I can't tell you how many governors have called our state saying, "Hey, can we steal your roadmap? Can we steal your plan? Can we steal your testing capacity? What can we do when to make our state do what you guys are doing right now?" And so if there are any silver linings, I hope you'll all just take a deep breath and look in the mirror and say, hey, you're part of making that happen. And we're lucky to live where we live with the people we live. So thank you so much. Keep up the good work, and we can't wait to see you again soon.
Terrific. Well, thank you, Lieutenant Governor, and enjoy that fair view behind you. You're welcome for the dad joke. Dr. Dunn, thank you very much for joining us. Brandy, any final comments?
Oh, thanks to both of you. Appreciate the time you take for us week to week.
Yep. Thank you for the time, and thank you for your service.
Thanks, guys.
Thanks, everyone.
Bye.